Good afternoon, everyone, and welcome to today's Mavs EDGE Internship Spotlight. I'm Julie Moy, Internship Coordinator with UTA's Career Development Center. I assist employers with internship program development and direct our Mavs EDGE program. Thank you for joining us this afternoon. We are very excited to welcome Parkland Health and Hospital System to today's EDGE Spotlight, the very first one that we're hosting this semester. We'll meet our panelists in just a moment, but first, students, you may begin sending your questions at any time using the Q&A feature. We'll address your questions near the end of the presentation. Our Assistant Director of Internships, David Powers, will be monitoring your questions. So let's go ahead and get started by meeting our special guest today, Rabin Pathak.
Thank you so much. My name is Rabin Pathak. I am the program manager over the internship programs at Parkland Hospital. And I manage a lot of education programs as well. I've been working at Parkland for the last 6 years, and it's been a long journey, especially in the same department and in the same field as well. Building talent pipeline, helping with education programs, doing some process improvement activities within the Office of Talent Management, and doing some data work as well. So those are my backgrounds that I did in Parkland. I also teach at Texas Women's University. I'm an adjunct professor. I teach health informatics for College of Nursing, as well as I teach research as well. I'm also a PhD student. Just like all of you guys, I'm doing my PhD in artificial intelligence and healthcare from UNT, and I'm in my final year now, so it's almost a year to go to get the doctorate degree there. Other than that, I like to volunteer in different organizations, talk with different youth and other people. So I'm also involved in ACHE, that's called the American College of Healthcare Executives. Also involved in ATD, Association of Talent Development here in Dallas as well. I do attend a few conferences throughout United States, some international if it's available as well. So I'm a big learner and an educator. And thank you for inviting me today to this spotlight.
Well, Robin, it's a pleasure to have you, and congratulations on your doctorate. That's I know that's very tough, especially when you're working full-time at such a large organization as Parkland Hospital. You know, and you have such a diverse background. I think that's very inspirational to our students. So welcome to our EDGE Spotlight. And I'm going to stop sharing my screen so that you can share yours. And thank you, students that are tuning in, for being with us today. I'm going to go ahead and turn the session over to Rabin, and he's going to give you an overview of the Parkland Health and Hospital System and its programs.
Thank you again. I just want to add one more thing to my introduction. Is I'm a UTA alumni as well. So I did my master's in healthcare administration from UTA. So, you know, I'm very much familiar with the school, and I'm part of the team as well. Thank you.
That's awesome. Go Mavs.
Yeah, that's right. Okay, let me just go ahead and share my screen. I don't have a big presentation or a slide today. I will just talk more about the internship program that Parkland offers. So I'll just explain what Parkland is a little bit for people who don't know. Parkland is a hospital. It's more of a healthcare system. We call it like a Parkland Health. That's where it's a county hospital located in Dallas, Harry Hines, where we have the big hospital, the main hospital in Harry Hines, where we have other different clinics throughout the hospital. There's like 5 different buildings. We call it the Anderson Building. We call it the Moody Breast Clinic. We call it the Wish Clinic as well. So I think a lot of you guys may know that Parkland is very famous for babies. So normally in 1 minute, the 3 babies are born in Parkland. So it's one of the biggest hospitals that you know, people come to deliver babies at Parkland. Also, the size of Parkland is pretty big. It's almost the size of an AT&T stadium. So it's pretty big throughout the whole location. The hospital is it's huge in itself. So if you get a chance to work at Parkland and go to the 17th and 18th floor around that place, you'll be able to see the whole Dallas area as well. We also have it's the #1 trauma center throughout the Dallas area as well. As you guys know that with a trauma center, you'll have all the doctors available in the ED and places as well. So in a day, we normally get about 1,000 patients come and visit in the ED, like almost in a day. So it's really busy. It's a public hospital, so you guys would be able to know what's the difference between Parkland and other hospitals as well once you get a chance to work with the county, with Dallas College and other Dallas entity as well. That's a little bit about the hospital in itself. We also have like different primary care units that we call, that is community health centers throughout the Dallas area. We have like about 12 of those located in Grand Prairie, located in Irving, and different parts of the Dallas County as well. So if anyone needs treatment for their basic, I would say, preventive and primary type of care, they would be able to go and visit those areas as well. So coming to internship programs, I'll just talk a little bit about what my department does. So our department is located in the Moody Breast Clinic there in Harry Hines. We're very close to the hospital. That's where the Office of Talent Management is. So we're inside the Office of Talent Management. Basically, it's called the HR. If you know, that's the old term used as more of a HR. We have like 6, 7 different departments within the HR as HR as well, where we're one of them that does a lot of workforce activities. Like we have programs for high school students, we have programs for college students, we have programs for master student, we have programs for PhD students, we have administrative fellowship program that runs throughout the whole year. We also produce different supports for the organization, just like patient care assistant, apprenticeship type of programs are running in Parkland Hospital. We have like career navigators that are inside the workforce as well. So there's almost about 5 program managers and other coordinators, supporting staff throughout the whole department. We have 10 people that are inside our department. And we report directly to the director of workforce, and her name is Teresa Wilson, and she reports to our senior vice president, who's Stephanie Spikes, and she reports to Felicia, who's our head of HR. So that's how normally the Parkland is run through. We also get a lot of educators through student placements. We get almost about 4,000 to 5,000 learners throughout the whole year, throughout United States, right? So everyone wants to come to Parkland to do their clinical rotations or to do their clinical activities. We have contracts with about 70 to 80 different colleges and universities where they would be able to come and do their clinical rotations at Parkland as well. We get a lot of UTA nurses as well, for clinical rotations at Parkland. So as UTA has one of the best nursing schools, so that's been really good. Talking more about what I do and what the internship is more about is we have this program right now that you can see in the screen. It's called the Ellie Fillman Collegiate Internship Program. So this is an 8 weeks long internship program that happens in summer. This is for college students. Anyone who is a senior in college or have 30 credit hours. So you have to have at least 30 credit hours to apply for this program. We just want you to get the basic understanding of your school and your basic, at least you have completed your basic coursework. So you'd be able to come and see the hospital environment and work as an intern in Parkland Hospital. So this program will start from June the 3rd, this year, and will end in August the 2nd. So it'll be around 8 weeks time. And you guys would be able to work here in different departments of your interest. So we have about 92 different departments in Parkland Hospital. So we try to place you according to your area of interest. And when you apply, there's on the application, there's a place where you have to mention what's your area of interest. Also, we have a lot of interviews. Interview goes on as well for this internship program. We normally get almost around, I would say, more than 200 plus applications for about 20-25 positions. So it's really it's competitive type of internship though. So we normally have 2 rounds of interviews for our selection process, and once that interview ends, once the first round of interview would be basically trying to know you and understand your interest and why you would want to be a nurse or a doctor or any type of healthcare staff in the future. And the second round of interview will be focusing more on your skill sets and what you can bring into the internship program, or what would be your, or how you'd be able to learn from the internship program as well. So it's more of a behavioral type of questions would be there on the second round of interview to see how you'd be able to handle situations. As you guys may all know, Parkland is a big hospital. It's the biggest hospital in Dallas County here. Also, it's very busy, and everyone, as you guys would get into healthcare is a very fast-paced environment. So you guys really would need to know the ins and outs of healthcare and be able to quickly change your job, quickly change your work, maybe switch from one work to another work when things are going on, and it could be stressful some days. So we would really want you to see how you would be able to switch gears once things happens inside the hospital. So even from the work that I do at Parkland, I have a fixed schedule, and I have a fixed calendar, but my calendar changes every day. Like within like few hours, something else comes in, or there's like, so we're almost prepared for everything that happens within the healthcare system. So that's more about the internship. I did talk a little bit about the internship here. Apart from the internship program, you would be able to work. So, okay, let me rewind back again. For the college interns, they would be able to work 40 hours a week. That's full time. This is a paid internship as well. So you get paid as you learn as well. So it's like earning and learning. That's what we call it. Also, you would be able to be working in the department of your choice, but we won't be able to give you a patient hands-on experience or be able to do any clinical activities, since you have to be a registered nurse or a doctor, or you have to be certified in that area to do those type of work. But you would be able to intern in those departments wherever you have interest in, maybe work with a physician or work with a nurse. They would be able to support you with your different activities, and you'll be doing more of administrative type of work even within the clinical settings, right? So so you won't be able to do direct patient care, but you'll be doing administrative work within that clinical setting. So you'll be able to see the whole clinical environment. You'll be able to work with your supervisors or your nurses or doctors, whoever you're assigned with, and then you would be able to support them with patient care, but you won't be doing direct patient care. Also, we have professional development Fridays that we do every Friday for our interns, where we call in guest presenters, we call in guest speakers. This happens for about 4 to 5 hours on a Friday, where you would be able to meet with different leaders throughout the hospital. We have events like coffee with the CEO. You have events like you have a panel discussion events with the senior C-suite leaders. Also, you'll be getting different trainings and activities such presentations such as like emotional intelligence that goes in workplace nowadays, the wellness as well, wellness trainings. Also, you would be able to get different sort of activities, like we'll do a field trip as well. We'll be going out to the community that Dallas community serves to meet with different community leaders. We'll be working in the food bank, like different sort of other activities. Also, we'll have you may be able to see the different buses that comes out through Dallas area that does preventive care. We'll be able to see the home health services, that's what we called. You'll be able to go through the CPR training if you want to get the full certification as well. And there's different other sorts of online courses or other in-person courses that goes throughout the hospital. So you'll be able to sign up for those and be able to be part of those as well. I'm not going to read out the testimonials that some of the interns have expressed while they were working in their different units here from a few years back. But I'll just talk about the requirement. As I said, this is primarily a Dallas County school, Dallas County hospital. So we do prefer people to apply from Dallas County, but even if you're not in Dallas County, you still would be able to, you still will be eligible as long as you're in the DFW area. Okay, so if you live in the DFW area, you can apply for the program. As I said, the 30 semester credit hours, this is really important because as long as you get started with your school, you would be able to know what your undergrad program is or your undergrad program is, then you'd be able to be ahead of a couple of courses. So you'd be able to apply those skill sets in the hospital. So that's why we require you to have at least 30 semester credit hours. That's technically like a year. Like if you have gone through a year in undergrad, then you would be able to apply for this program. GPA, I would say, is 3.0. That's our minimum GPA. But let's say if you have 2.9, or if you have like 3.1, if you don't meet the GPA criteria, I do still recommend you to apply, because as you guys all know, the interview, when you face the interview, if everything goes out well, then we do consider sometimes in the GPA as well. But the basic requirement is 3.0 to apply, right? Again, we would try to with a college with the bachelor's degree would be the priority, like going in an undergrad school. Even if you're in a master's program, you can still apply. So we'll still consider that as well. And you have to have the willingness to work in healthcare. That's the biggest thing that we look in, to a lot of people in the healthcare industry nowadays, since healthcare is changing every day. You have to have the willingness to work in the healthcare industry, and it's a serving type of environment. Application deadline is March 15, so we still have a few months left. So I would want you guys to prepare your documents, or prepare what things is needed to apply. It's a very simple process. You just go to the click here and apply button here. Once you click on this, you can see my page here. It says Illy Feldman. So you just go apply now. You create an account here for Parkland Health, and then you apply. You fill out the application and you submit the application, right? Along with the application, what we still require is a personal statement. So I would want you guys to go and write down your name or a personal statement here, which program you're applying to. And then it's basically like some of the requirements that some of the questions that we have here, just trying to explain that whether you'll be able to work 8 weeks or not. There may be some occasions where you may be sick, or you may have some important events going on a day or so, but this is just for 8 weeks, and it's working in a healthcare environment. And if you miss 2 weeks out of 8 weeks, then that won't be fruitful. So we just want to make sure that you get the full out of the internship as well. Again, like, the availability is like, this is going to be an in-person internship. So as in healthcare, you need that exposure working with the environment that you will be working in the future in. So all of the internship would be more of in person. We did do some remote internships when we had COVID-19, when we're in the COVID time period. We had some hybrid for some IT students and things like that, but most of this internship would be more of in person going forward. Also, and it's just a basic essay that we would want you to write down to express your interest in Parkland's Health and what you want to be in the future, or what's your career goal, why you want to do an internship, and things like that. And there's another program brochure here that if you guys just want to read to understand what Parkland Health is, what's the objective of the program, and things like that. So, and if you have any questions, there is a place here that says WD Internship Programs. That's an email address. So if you just email this, then you would get a reply within, I would say, a few days. Okay. That's more about the internship program. And I think I did share a lot of information about the requirements and things like that so far.
I mean, it sounds like an amazing opportunity for anyone who's interested in the healthcare field, from administrative side to nursing, or just so many different possibilities in the medical profession. So for 25 students, this is a really great opportunity. I have a couple of questions about the internship program specifically. Are there any particular majors that you're looking for?
So I would say a lot of majors that comes in are like pre-med students, or maybe biology or pre-med, or maybe health science majors. But there's no limitations on any major. We are open to any majors, even IT people having an IT major have applied and worked in Parkland Hospital in the IT department. That's a great experience as well. That's serving people, and you'd be able to help with different IT projects that goes on inside the hospital as well.
That's great to know. And I really appreciate you painting a vivid picture of what it's like to work, no matter what position you have within a big hospital like that. It's changing day to day. It's not just sitting at a desk. It's very hands-on, and for students to be prepared for that. But it's an incredibly rewarding career as well. And
I just want to add one more thing to that is like some of the departments are like, I would say, poison center. That's one of the biggest poison center in Dallas. Like I mean, that experience is really great to understand what type of poison patients, like what type of people come to the hospital if they have poison situations, like, some of the other stuff I would say is accounting and finance. That's a big thing in the county hospital. I would say planning, design, and constructions. We have some interns in that area. We have correctional health as well. So Parkland also has a clinic inside the Dallas jail. We call it correctional health nowadays. So you will be able to work in that environment as well with doctors and physicians. So you'd be able to see that exposure as well in that correctional health setting as well. How people are treated inside that hospital, and what work is done inside that hospital as well. I would say there's other things like diversity, equity, and inclusion. That's a big thing as well nowadays. So it's so vast. Like I can't name each and every 92 different departments, but we had 35 different departments that took part last time in the 2022 summer internship programs. We just want to spread the student as much as possible according to their interests. We don't want to have like 3 students in one place, but so you'd be able to get that full exposure and that full experience with 1 or 2 of your colleagues. So that's great type of experience. We also hire 25 high school students. So we have a total of 50 interns that goes through the whole summer internship programs, where when we have these professional Fridays that I talked about, where the high school interns and the college interns comes all together into one setting, and they go through the professional courses and things like that. So there's big bonding between those the same generations, or some high school students get some college students helps high school students to apply for school and things like that. So there's that big bonding that goes inside the hospital as well.
Again, a fantastic opportunity. UTA has a large international student population. Would they be eligible to apply for this internship?
Yes, yes. Any international student can apply for the internship. They just have to get a clearance letter from the international students office. We had few students from UTA in the past as well who are international students. And once they have the clearance letter, then they would be able to work at Parkland.
Okay, fantastic. I love to hear that. Now I have just a few kind of generic questions just relating to internships and the interview process, since you have such vast experience in this area. What's the best way that a student can stand out during the application process or during the interview process?
So what I would say is the first thing is the resume. So that's the ticket, that you need to get into the door. You really have to have a good resume that has your education, that has your experience that you have learned in school or some other experiences, and then some volunteer or leadership activities. I would say a little bit of your technical core skill sets, what you guys have learned or what you guys can bring into the table. So some of those things plays a really key role. Technically, I think everyone may know this, but when someone from HR reviews a resume, the resumes are reviewed only for about 8 to 10 seconds. So we would know whether the student is fit for the program, or how the student has prepared itself. So that's your biggest gateway, I would say, is to have a really good resume written up. Especially I think UTA Career Center helps a lot with resume writings as well. So having your resume revised, not having any grammatical errors, trying to have everything there on the spot where people can be be able to see what's needed. Always make sure you have your phone number or your email address located on your resume, because again, like if you have 200 applications, a recruiter will not go back and look, ask them what's your phone number. Once if there's information missing on your resume, then technically, you won't be selected for the program, even if you are really interested to be a part of that program. I would say also, update your LinkedIn profile. That's a big thing as well nowadays. So you always have your link of your LinkedIn profile on your resume as well, just in case, because resume technically, I would say, would be good if you have 1 to 2 pages max, and you can write a lot of your other project experience or your information on your LinkedIn page. The recruiter can go into the LinkedIn page and see what other experience you have if they want to know something in detail, right? So that would be a biggest thing I would say. Also, I would say academic performance, that's a big thing. Like you have to be good in school so that you can apply those school knowledge skill sets to where you're working. Extra activities, leadership roles. We do look into a lot of leadership roles because I would say in healthcare, everyone is a leader because you have to make decisions right there in the spot. Some of those decisions are like, are like you have to help patients, you have to help employees and other stuff like that. So you have to have that leadership skills. You have to be willingness to be able to change the work environment. Like sometimes, some days it could be a busy day, some day it could be a little bit low day. Hospital settings are almost like that, like, so and things like that. So we had a really busy schedule when we had the snow, like a week ago. Hospital doesn't close, it's like 24 hours. So the nurses, doctors, even us working in the HR field, we sign up for different activities, like to help them and support them if we need to in those type of occasions. So we look into those type of stuff. Also, your essay plays a big role. We want to know where you want to go so we can help you achieve your dream or your goal. Let's say if you have interest to be a nurse, then we would want you to express that in your writing, to say which type of nurse you want to be or which area you want to work in. Do you want to work in outpatient nurse? Or there's thousands of jobs inside nursing as well. So if this more specific, would be able to know which areas you would be able to work with. I would say being diverse as much as possible and getting that experience, and then also building that network. Those are the things that we look into an application.
Thank you for that. And those are things that we talk about here at the Career Development Center as well. But I think it's nice for students to hear from someone who's actually doing the hiring what they look for. So I appreciate your insight. This is kind of along those same lines, and you mentioned being flexible with schedule, but what are some of the other characteristics you look for in potential interns?
I would say communication skills. That's the biggest thing in the hospital setting. So you have to say the thing, a correct way, so that there's no miscommunication or the information is transferred correctly to your doctors or nurses. And you have to be able to be a team player. I would say that's a big thing as well. In a hospital setting, you cannot work individually. There's always a group or team that people work with. Even within the nursing sector, there's a nursing team. The doctors, medical people have their medical teams. Even within HR, even for me to do my job, I need support from like 3-4 different people. So everything is a teamwork. So you have to be collaborative, have that team skill set. And I would also add a little bit of time management. So if you say you would be there in the hospital at 8 o'clock, you can't be there at 9 o'clock. So you have to be there at 8 o'clock because that's the signed shift that you signed up for. I would say so, and that's patient care also, right? Because if you are later on in the future, if you're dealing with patients, you want to make sure that you are on time with your activities and things like that. Because even with few seconds, we can save people's lives. So we deal with a lot of time sensitive type of work and issues like that. be able to network, I would say that's a big thing, because just to this is 8 weeks experience. A lot of interns come back to Parkland as a full-time employee once they build that relationship with their department, or with with us or other talent acquisition people, so that there's always job postings on Parkland's website where people would be able to apply for jobs. There's always like about 200-300 job postings every Monday that comes out. So there's large opportunities to be, again, a full-time employee once you finish your internship or once you finish your school as well.
Fantastic. So it sounds like the way an intern could make a good impression is by being on time, networking, being flexible, being a team player. Is there anything else you can think of that, once they get the internship, how they could stand out, or so that they can secure maybe a full-time position with the health system?
Yes. So we had some situations in the past. There was one intern who was working in the Dallas Poison Center, and he revamped the whole database of the database of the Dallas Poison Center when he was an intern. And once he finished the internship, he was able to apply for positions at Parkland. So those are those rewarding type of experience that you guys may have. Like some of you guys may be really good with data work. Some of you guys are maybe really good with presentations, or maybe making PowerPoint presentations or slides. Some of you guys may be really good with creating flyers. And different or doing event management and things like that. So it's just like, if you stand out in a group, it's very easy to get a job. You will be noticeable. People would know that this person did this type of job. Also, there was another intern, like we had these pagers that we used to provide the doctors. So the doctors used to take the pagers, and whenever a message is sent to a pager, it used to take about 5 to 6 minutes for the message to appear on the pager. But that intern came in and revamped the pager system. Within a few minutes, the message was able to be sent into the pager. So some of those process improvement activities that I would say, because the thing is, in healthcare, a lot of people are doing multiple jobs. They don't have only one job to do. So they're managing like 2-3 different type of jobs within healthcare field. And if someone can bring in that special skill set and be able to change the environment, then those are very noticeable type of jobs that people have done.
Well, that says a lot about Parkland to allow interns to soar like that, to run off with an idea and implement it. And that's true experiential learning. And again, it's just such a great opportunity for our students.
And in Parkland, one thing that I want to add is it's a very two-way learning culture. I would say I learn a lot from my interns that join the program, as well as the departmental managers who are the supervisors over these interns. They have said they have learned so much experience from the interns as well. The thing is, since we are so busy in our environment that we work in, we don't have the skill set that the new interns can bring in. From nowadays, we talk about AI, we talk about artificial intelligence, we talk about different other skill sets that the interns can bring in. We always want to, be able to give them a space where they can show their skill sets and be able to help the hospital in itself as well.
Yeah, absolutely. And that kind of brings me to a question that I was going to ask a little bit later, but you mentioned culture, and I know you've talked about teamwork and various things, but how would you describe the culture at Parkland?
I would say it's a county hospital, so it's a mission driven type of culture. So most of the patients that comes to Parkland Hospital don't have insurance or are through the Medicaid or Medicare program. That's our biggest revenue. And I would say, since Dallas is so diverse, all the patients that may not be able to go to Baylor or THR or other hospitals, they come to Parkland for care. So Parkland is also called a safety net hospital, because even if you are not able to pay for the service or the fee for your treatment, Parkland does that for free for anyone who comes into Parkland. So I would say it's very, very community-driven type of culture. We work very closely with the community people, as well as the community leaders and other different sort of environment that comes to Parkland. I would say training, it's a big institution for you. So a lot of people ask me, what's the difference between Parkland and UT Southwestern? So we are a different hospital though, but UT Southwestern is a medical school, where Parkland is a teaching hospital for that university. So any doctors that are going through their or any medical students going through UT Southwestern does all of their practicums or does all of their medical school training within Parkland Hospital. So that's interrelated. So any doctors in Parkland, any doctors in UT Southwestern would be able to come and work at Parkland. So it's like, it's a two-way system. That's another thing that we have. We work very closely with UT Southwestern. We work very closely with Children's Health. We work with the Dallas County. We work with the Dallas Mayor's program. We work with a lot of things that goes within the Dallas County area. Also, team collaboration, I would say that's a big culture at Parkland, where you'd be able to collaborate with anyone within that system and be able to make those connections as well and be able to work in that team. Yeah, those are the mainly difference between the culture that Parkland has.
Okay, thank you. I want to see if we have any questions from our students. David was kind of fielding those. I saw one pop up from a student asking what the job opportunities are for bioengineering majors.
So we do have a bioengineering department that does a lot of engineering work. And again, job opportunities are always there. But again, as everyone knows, like if you go through the internship program, that will be better. It will be easy to make those networking and connection for any job openings that comes out in the future. So yes, as I said, there's 92 different departments. There's always a position somewhere inside the hospital for any majors.
It sounds like the possibilities are endless. So if students, they apply, they can also find this, we have it posted in Handshake, which is what we use here at the Career Development Center. But once they apply, what's the best way to follow up with you or your department and to reach out to you and show interest?
I would say once you apply, just wait for a few weeks. It does take time to process all the documents and be able to review the resumes and things like that. So once the deadline ends, if you give us I would say after March 15th, if you give us few weeks for us to review the resumes to make sure that we have everything what we need, then you would be able to email the email address that's on the website here as well, CWD internship programs. Then you will be able to get a response to see what's the positions or what's going on. But technically what's going to happen is we will be doing a lot of interviews in the month of April. So you would definitely be able to hear something after March 15th if you get selected for an interview.
Okay, fantastic. Is there anything else that you want to add or promote? You've been very thorough and this is so informative. Great information for our students and this opportunity that's coming up for the summer. But I want to open it up to you if there's anything that we didn't cover.
I think we've covered almost everything. I just want to tell the students that, this is a great opportunity and this happens once a year. So I do encourage everyone to apply. We have other programs as well. We call it the multi-semester internship program, where the interns go through the whole 1 year of internship experience in the hospital. So we have five interns that goes through those programs every year. That typically starts in spring and ends in the fall. So for the whole year. And those are mainly for seniors or undergrad or grad students, right? So those are the other opportunities. Please do go and look into the website here that we have to see any other opportunities that you may be interested in. But for now, I would say the internship is open. This is a great place to start off with and be able to get that experience that people are looking for in healthcare. And And Parkland is a great place to work as well. I've been there for 6 years, I would say. I started off as a coordinator, then I got promoted into a specialist role. Then now I'm a program manager. So there is a lot of growth, even if you join Parkland as a full-time employee as well. So, and that keeps you moving on doing your stuff and things like that. So it's a great place to work. And if you're in healthcare, I would definitely, pick Parkland as one of the top priorities.
Well, and it's actually one of the biggest healthcare systems in the country, if I'm not mistaken.
Yes.
Yeah, absolutely. Do you post most of your positions in Handshake, or is it better to go to your website?
So it's on the website. I can request our TA to post it on the Handshake as well. We did that for the multi-semester internship. So by today night or tomorrow, you'll be able to see this in Handshake as well. In UTA's
yeah, I think
Handshake.
it's already it's posted in Handshake, this position, so students can begin applying.
Yes.
Fantastic. Well, thank you very much for being our guest today. It's such a pleasure to learn more about your organization. Thank you, students, for joining us. Please make sure that you have looked at the chat to get information, contact information, and also opportunities within the Career Development Center. Thank you again, Rabin, for being, again, our special guest today. And students who are tuning in, good luck this semester. I know we were off to a crazy start with the ice storm, but we're getting into full swing, and this was a fantastic way to kick it off.
Thank you again for giving me the opportunity to speak about the internship programs that we have at Parkland. And I look forward receiving a lot of applications from UTA. Thank you again.
All right. Have a great afternoon, everyone.
Bye-bye.
Thank you.